Hi divers, welcome to another interesting Friday. I've missed you guys honestly. Today we are talking about health. We need to be healthy to be in a relationship, right? Yes, I know you agree with me. And today we are talking about diabetes, what you need to know, the causes, prevention, the management, the types, anything you just want to know. So take your pen and paper, get ready. And I'm doing this with a professional, a health professional. Once we get back from the break, you'll get to know this person. Today with me to do this topic, which is on diabetes, is Mr. Noah Tekpor. Mr. Noah Tekpor is a mental health nurse. So don't worry, we got you covered. Mr. Noah, welcome.
Thank you so much.
Welcome. Thank you for honoring our invitation.
You're welcome. Thank you so much for having me.
Good.
Yeah.
I know my guests are ready to take down,
Yes.
to jot down the notes and tips you have for them.
Okay.
So let's delve into today's topic.
All right.
So we are on diabetes.
Okay.
And we'd like to know first of all what is diabetes?
Okay. The technical name is diabetes mellitus.
Diabetes.
Mellitus.
Okay.
All right. So diabetes simply means when there is too much or high level of sugar in your blood, then we say you have diabetes.
Okay.
And you know, the cells in our body, they need energy to work.
All right.
And the source of their energy is sugar or glucose in the blood. And you know, so when you consume carbohydrates, carbohydrate foods like cassava, you know, maize, rice, yam, you know, all those starchy foods, you know, when you consume them, they go through digestion in our body. And the end product is sugar or glucose that enters your bloodstream and runs through the blood. So they remain in the blood and they circulate in the blood, you see. But to get to the cells, for the cells to use to work, it needs a helper or it needs an aid, and that is what we call insulin. Insulin. So insulin is a hormone in the body that aids the sugar in your blood to get to the cells for the cells to use to work. But for one reason or the other, some people are unable to produce insulin or unable to use insulin. That's what brings about the types of diabetes that we have. Yeah, so very soon we look at the types of diabetes and their causes. All right, sure. I was going to come to that. I know we have diabetes types, but yes, or we will get to it. Okay. So right now, you mentioned cassava, rice, and these are all Ghanaian foods. These are the food we consume most in Ghana. Exactly. So does that put us at a higher risk as Ghanaians, diabetes a higher risk? Like, are we at a... Oh, not really. You see, if you have the condition, then there's a way to go about it. Okay. But these are staple foods that we cannot run away from. We cannot run away. So if you are diagnosed of diabetes, there's a way the health workers will advise you as to how to consume these foodstuffs. Okay. Yeah, so we'll be looking at all those things. All right. Yeah. I know myself and some of the viewers, we've been thinking, if I should be taking porridge or maybe tea or something, meal or something, the amount of sugar I put into it, that is what I believe gives diabetes. Is that it? It's not really, you know, when you talk about sugar, what comes to people's mind is the sugar we have on our table. Sugar. No, but any starchy food that you consume, the end product is sugar in your bloodstream. Okay. So not necessarily the sugar, the table sugar that we put in our beverages and all that. Yeah, so any starchy food that you consume, the end product is sugar in your bloodstream. Okay. Yeah, that our viewers should know. So it's not the amount of sugar I pour in my porridge, like the sugar we buy, that causes diabetes? No. Okay. We'll look at the causes very soon. Okay. One misconception is cleared. Yeah. But we'll get to it. Exactly. So now we are going to the types of diabetes we have. Yeah. And then you tell us what causes which one and
and all of that. So
All right.
what are some causes of...
All right. We have various types of diabetes, but I'll focus on only 3, the most common ones,
okay.
the 3.
Okay.
The first one is normally called type 1 diabetes or insulin-dependent diabetes.
Okay.
Now, that one, what happens is that there's an organ in the body we call pancreas.
Pancreas?
Yes.
Science.
So it's pancreas that produces the hormone insulin that I spoke about earlier.
Okay.
So insulin helps the sugar in your blood to get to the cells.
Okay.
All right. But for a reason, we call it an autoimmune disease. That's your immune system automatically destroy the cells in the pancreas that produce the insulin.
Okay.
Therefore, in such people, they cannot produce insulin. They don't have insulin.
The type 1.
The type 1
diabetes.
Yeah,
okay.
those who have the type 1 diabetes, their body does not produce insulin, or the pancreas does not produce insulin.
Okay.
That will aid the sugar to move from the bloodstream to the cells. So normally, they are diagnosed, it's diagnosed in childhood. So from birth, they have the disease, diabetes, because they don't have the insulin. Their pancreas cannot produce insulin.
Okay.
Right. So that's the type 1. So type 1, they don't have the insulin at all to aid the sugar to move to the cells.
Okay.
That's type 1.
Okay.
It can be developed at later age though, but normally it's diagnosed in childhood. And they grow with it.
Okay.
All right. Then we have type 2. Type 2 is insulin resistant. That's the insulin is produced all right, but it may not be sufficient or enough.
Okay.
Or it's produced all right, but the body does not respond favorably to the insulin.
Okay.
I get my point. So even though the insulin is produced, it's not effectively used.
Okay.
That is type 2.
Yeah.
Yeah. So that one. So type 2 is not as serious as type 1 because type 1 they don't have the insulin at all.
Okay.
But type 2 they have, but just that the body cannot use it effectively, or the insulin is not enough for the body to use.
Okay.
So that's type 1 and type 2. And normally type 2 is diagnosed in adults.
Adults?
Yeah, yes, type 2.
Okay.
All right.
Unlike type 1.
Yes, exactly. Then we have the gestational diabetes.
That's another type.
Yeah, the third one.
So we'll get to it.
Okay.
I know they are jotting so much. Please, just wait. We are going to go on a break.
Exactly.
I want all of you to know that November is Diabetic Awareness Month. Diabetes Awareness Month. So we at Deep Dives, we are also adding our voice to it. So don't leave. We are getting back with the type 3, type, and just the type 3.
Type 1, type 2, and
then the preventive measures and all of that.
Exactly.
Stay tuned.
Yeah.
Enigma Eatery and Sports Bar.
Okay, Mr. Noah,
Yeah.
Before we went on the break, you were going to talk about type 3. I wish viewers were here in the studio with me. The information I'm getting, the education I'm getting from you.
Yeah.
Can you go ahead with what you started with?
Okay, so as I said earlier, we have type 1, type 2, and the third one I want to talk about gestational diabetes.
Okay.
It's a diabetes where someone who is not a diabetic, but after becoming pregnant, then becomes a diabetic. Are you getting my point? And the placenta releases hormones that actually make the insulin inactive.
Okay.
So such people, some of them after delivery, they go back to their normal health status. But some, it continues. Yeah, so that's the gestational diabetes. There are other forms of diabetes, but as I said earlier on, these are the three most common ones that we have. So type 1, type 2, and gestational diabetes, becoming diabetic when you are pregnant.
Okay.
That's the gestational one. Then, yeah, so
that one looks a little, or sounds a little scary.
Oh, not scary. Yeah.
I don't know myself to be diabetic. Yeah. Just getting pregnant and going through all that, then okay, it's fine.
Yeah.
And now we want to know some of the signs and symptoms. I might be going through one. I wouldn't know if it's a sign or symptoms. If you can educate us a bit on some signs and symptoms of diabetes.
Okay. Signs and symptoms of diabetes. We can talk about increased tests.
Tests?
Yes. Increased tests. So to go into a local pass, and so come doing 10.
Oh, okay.
Yes, increased tests. Okay. And because of that, you may have dry mouth. So your lips become dry, your mouth becomes dry. Yeah, it's there. We have a frequent urination.
Don't worry.
We have.
I'm sure by now some people are touching their hearts. And don't worry, he's here to release you or relieve you of every worry. Don't worry. Yes.
We also have frequent urination.
Okay.
Yes, a frequent urination.
Yeah.
It's also there. Then we have blurred vision.
Blurred vision.
You say that your vision start to become blurred. You cannot see properly, clearly.
That one is not as a result of eating a lot of gari.
No. It's also a sign that maybe diabetes is trying to come in.
It's working.
Yeah, and also when you have a cut, when you have a cut, a wound or sore, it's
the blood doesn't clot.
It's like not the clotting, but it takes time to heal. The healing becomes very slow.
Okay.
It's also a sign. Just a little cut, but rather it keeps expanding, and the healing process is very slow.
Okay.
It's also a sign that diabetes may be maybe setting in. And if you are trying to have a problem with your sexual activities,
okay.
Sexual dysfunction, your
We
performance in bed, it's also affected in a way.
Okay.
It's also a sign that this condition is
that
trying to...
That particular one, can you elaborate it? So, like, performance in what sense? So, if you do 2 minutes, now you're doing 10 seconds, and I don't...
If I want to talk about sexual dysfunction, that was even the chronic, or should I say, then the condition has gotten to the complicated state where we have erectile dysfunction in case of the men. Erection becomes a problem because what diabetes does is that it affects the blood vessels and the nerves. As you know, before a man can get erection, blood must flow into the penis, and the nerves must be functioning well before. But the moment these things are attacked and destroyed, it affects the person's sexual performance. Yeah, so the same thing happens in case of the ladies. They also have vaginal dryness.
Okay.
Yeah, because the blood vessels and the nerves, they also play equal role in how the lady, how do we call it, becomes wet when it comes to sex. Yeah, so these are the complicated states of diabetes. We also have what we call nephropathy. That is the kidney. So when diabetes becomes very complicated, your kidney may have a problem. You may have a kidney failure. Yes, we have what we call retinopathy. That is your...
Mr. Noah.
Hello.
Where you are going there now, we have to be...
I have to come down.
We need to go and pick our kiolas and... Okay, so like... I just want to know what basic stuffs that will prompt me to, go and do my diabetic checkup. So you mentioned the test, the urination. Yeah,
frequent urination, the increased test.
Dryness during sexual, and then the men not.
Yeah.
So aside that, which other basics one do we have before when the kidney ones when it becomes severe, right?
Yeah.
So we want the very, very basic ones.
Yeah.
Which I know some of the symptoms may be looking like.
Exactly.
Some other
condition. Exactly. Yeah. So to confirm it, a test must be performed at the health facility.
Go to the hospital.
Yeah. Well, sometimes these signs and symptoms do not even show as early as possible. When you go to some health facility, we have what we call routine blood check.
Okay.
It's a routine thing. When you go to the facility, it's a protocol that you must go through whether you have diabetes or not.
Okay.
It's through that protocol that those who have the condition are known.
Okay.
So when you go to the health facility, as part of the requirement, you must perform sugar tests.
Sugar tests, jot it down.
So it's through that process that we get to know, we screen for those who have the condition. Are you getting my point?
Okay.
But when you come to our local balance, we normally say that when you urinate, and after 5 minutes, you see ants.
Yes.
Ants around your urine or your wee-wee or your pee. It's a sign that there is a sugar in your urine, which is not supposed to be so.
Wow.
So that should give you, that should alarm you, to take a step.
Check up.
Exactly. Exactly.
This is getting interesting. I know the viewers will attest to that too.
Yeah.
So what are some management
Okay.
Mechanisms to manage
okay.
Diabetes. We don't spill it. We are coming back.
Okay.
For you.
Okay.
Okay. So some management.
All right.
How do we manage diabetes?
Okay, if you are diagnosed of any kind of diabetes, okay, the first thing is monitoring.
Okay.
So we have what we call glucometer. Those who can afford, they have it in their homes. They have the strips. You know, every now and then they check their sugar level on daily basis or any other alternative.
Is it like a device or
It's a device. We call it glucometer. It's a device with a strip. It comes with strips. So you take a sample of your blood and you check your sugar level on daily basis. If you cannot do it on your own, you visit any nearby health facility for checkup, daily checking of your sugar level. You have that one. Then we have oral anti-diabetic medications that you take. All right, that's if you are diagnosed. Then we have insulin therapy. You know, as I said, type 1, they cannot live without insulin. They are the people who inject themselves on daily basis. Are you getting my point? And the insulin, it comes in various forms. Okay, the one you can afford and the one that is suitable for you, you go for that one. So the insulin therapy is also there. Yeah, and the oral medication is there. The monitoring is there. All right, then you also go for a healthy lifestyle. Okay.
So, yeah, we know some of our lifestyle habits lead us to getting all of this. But
exactly.
For a diabetic patient or someone who is diabetic, what are some of the food or some of the, let's go back to lifestyle, we should do away like we should just not engage in or not eat and all of that.
Okay, so earlier on I talked about type 2 diabetes where your insulin may not be functioning effectively, okay, or the cells are not using the insulin effectively. I get my point. So if such a person, you know, is consuming sugar anyhow, you are at high risk. You know, you can easily get the disease. I get my point.
You already have a lot of sugar, or what?
No. It's like your insulin is not functioning very well. Okay. So you need to cut down on your sugar consumption. So when I say sugar consumption, you look at carbohydrates.
Okay, the rice
and those things, cassava, you have to cut them down, okay? And also these fizzy drinks. Okay. You know, where you have too much sugar in them, you have to cut down these drinks, okay? Should be in moderation. Okay. Are you getting my point? But if you are type 1, with a serious one, that one, you have to drastically, you know, reduce carbohydrate intake and focus more on vegetables. Vegetables.
So which means you just become a vegan or a vegetarian by force.
If possible. You consume more vegetables. Vegetables.
Mr. Noah, hello. I like that you are here today.
Thank you.
I know they are also enjoying, but we have to go on a quick break.
Okay.
Once you are back, we talk about the prevention, the war.
Exactly.
So, US, see you.
Yeah.
So easy watching movies on Lumflix. Open your browser. Type and visit lumflix.com in your address bar. Sign in if you already have an account or create a new one by clicking sign up. Provide your details to complete the sign up process for free. Now, you are ready to watch any movie at the comfort of your home. Lumflix, access movies with ease.
Hi divers, we are back to the topic, and before we wrap up or before we leave you, we just have some few minutes to go. We would want you to know some of the preventive measures. I don't want to be a diabetic person, or I don't want to get this condition. What are the things I should avoid or I shouldn't do to get there? So, Mr. Noah, can you hammer that?
Yeah, okay. So it's all about healthy lifestyle. You know, you eat a balanced diet and a healthy diet.
Balanced diet.
More vegetables and fruit. Viewers, more vegetables and fruit. Cut down your sugars. You know, carbohydrate foods, cut them down. Any meal of yours should have, the carbohydrate should be the least. More vegetables, protein fine, but cut down the carbohydrates. avoid fizzy drinks. Avoid fizzy drinks. Cut down the alcohol or don't even take at all. Quit smoking. Quit smoking. Involve in healthy activities like exercising. Take a walk around. You know, all these things will help you actually prevent the condition in your life. Yeah. So healthy lifestyle is very, very important. Yeah.
So it all boils down to lifestyle, healthy lifestyle.
Yeah.
Make sure you live right.
Yeah.
The life is only one.
Yes.
Let's live right.
Yes.
Okay.
Yes. So
And,
when you notice any sign of diabetes that we talk about, I advise that you visit a nearby health facility and check yourself up. It's very, very important.
Okay.
You know, even if you don't see any sign, you just take a walk to a health facility that you want to know your sugar status.
Okay.
Check your sugar level. It's very, very important. You may have it, but you may not know.
Okay.
Yeah. So it's very important you take that step to stay healthy. To stay healthy. Yeah.
Thank you.
Yeah.
Thank you, Mr. Noah.
Yeah,
I know we
thanks
would
for
want to have more and more. We can't have enough of you, but we can schedule for another time.
Sure.
Please leave your comments in the comment section. Ask your questions. Every question, I'll get it to him. He will answer all your questions. So we are coming to you from Enigma, spot by NE3, Oyebi. Don't forget to visit this place. And see you next Friday. Bye-bye.
Bye.